Hello, and thank you for joining us for another webinar session here at Senior Health Medicare. Today we have Kevin Tunison and Nick Carter. They're here to talk about why to choose Senior Health Medicare to help with your Medicare plan. So without further ado, Nick, Kevin, take it away.
Hi, everybody. My name is Kevin Tunison. I am the CEO, managing partner of Senior Health Medicare. I've been working with seniors on Medicare for around 14 years, I guess. And we started Senior Health Medicare about 4 years ago. We had another agency before that was kind of doing something a little different, and we decided to do things a different way with Senior Health Medicare. And that's actually a bit about what we're going to talk about today. Nick?
Hi, everyone. My name is Nick Carter. I've been in the financial industry for a little over 15 years. And been specifically in the Medicare insurance field for about 5 years. I'm one of the senior advisors here.
So today we're going to start with why you need somebody to help you with Medicare. So, one thing that I've noticed over 14 years is we run into a lot of people who do it themselves, and that's okay. I mean, I do a lot of things myself that I probably shouldn't. But it's, this is one of those things that you really need to be ingrained in, knowing what's happened in the past and helping to discern what's happening in the future. And it's such a big task what we do that we kind of are constantly learning. There's new information coming at us left and right. We've got healthcare bills and new presidents and different Congresses and all this stuff going on in the federal government. It affects this. I mean, a ripple effect in the federal government rolls through Medicare like crazy. The Affordable Care Act changed things yearly with Medicare. So, these are standardized plans, but there's a lot of hidden stuff. The hidden stuff is really the stuff that, as they call the gotcha. The surprise stuff that you don't want. Why you need someone to help you with Medicare, Nick, you can go ahead and take it away on the first bit there.
Sure. Well, to add on to what you said, I mean, there are a lot of moving parts with Medicare and Medicare supplement plans. And this is something, whether you know it or not, that you're paying for. Whether you use an agent, an advisor, or a broker, or you enroll directly with an individual company, you're going to pay the exact same rate. So it's not so much why do you want to use someone, but why wouldn't you use someone to help you? I mean, for example, if you enroll directly with AARP on your own and you get a rate increase and you call them and say, hey, what's up with this rate increase? Is AARP going to say, well, let's look at Mutual of Omaha? No, they're not going to do that. Whereas if you work with someone like us, who is a non-captive broker, we have those tools available to us. And it's in our best interest to always make sure that you're in the best plan and that you're happy, not that you stay with our one company that we have to offer.
Yeah, insurance carriers literally hire and train people. They have departments called retention. So when you call and say, hey, I hate this, their job is to make you love it again, right? And our job is to say, okay, I'm going to hate it with you. And let's find something that we both like. And that's important to note because, again, in the years I've been doing this, things change. And we've seen companies with 30, 40% increases, companies that were great, really good at service, really good at everything else, and all of a sudden something happened internally, whether they have a change of CEO or, just decide to do something differently. That's something that we try and get ahead of for our clients. And Medicare is a specialty. And, we've got a common saying here. I always say, would you go to the muffler shop to get your brakes fixed? And they probably know how to do it, but they don't have the parts they use aren't as good. The quality of service isn't as good. Would you go to a podiatrist for a heart issue? You wouldn't. It is a specialty in that way. In the financial services or insurance world, a lot of people buy from financial advisors. And whether it's misinformation or shady tactics, it doesn't matter. The end result is the same for you. So and we actually work with a lot of financial advisors that use us to do the Medicare because they don't know it. And they typically will find one or two programs that work because everybody tells them it's a standard program and everything's the same. But I mean, that's not really the right advice. We've seen some of these programs go to $300, $400, $500, $600 when you could be paying $150. So what we look at is, we keep our ear to the ground and make sure we know what's coming and try and give you the best advice we possibly can and help you with the best, most cost-effective coverage. And it is a very predatory industry. 10,000 people turning 65 every day. When I started doing this, there was maybe 10 companies that we used doing Medicare supplements. Now there's 40 or 50. And at that time, companies have jumped in and jumped out. And guess what? You are rich. Whether you feel like it or not, collectively, seniors right now have all the money, the richest subpopulation of people in the United States. So you have a lot of financial companies who are now offering Medicare supplements. It's not their business. They've never done it before. They usually reinsure it through somebody else. You're not actually buying that company. You don't even know that. They use it as a loss leader because now they have what? They have you. And now they're going to throw life insurance ads at you and call you and I want you to buy long-term care and cancer policies and life insurance and annuities. And do you want that company that treats a Medicare plan as a loss leader, or would you rather have a company where they treat Medicare plans as their baby? So there are companies out there that do that. It's their core business. So that's why you need somebody to help you, and that's why you need a specialist to help you. Nick?
That's right. Let's kind of shift gears to picking the right company and why we shouldn't focus on, just the brand. I mean, especially seniors who are turning 65, their mailboxes are getting stuffed with probably 5 huge name insurance companies. And usually when you're under 65 and you're used to be maybe an employer plan or an Affordable Care Act plan, it might make more sense to go with a big brand name company, but it doesn't always make sense to do that with a Medicare supplement. And there's some reasons for that. In my opinion, the biggest reason is that these plans are standardized. So, when you're under 65 and you're on a group plan or individual plan, one of the biggest things you're looking at when you're picking an insurance plan is the network. Does my doctor take this plan? What are my co-pays going to be? Am I going to have to get a referral? Am I going to pay, a huge deductible? Whereas with a Medicare supplement plan, it doesn't matter what company you have. As long as the doctor takes Medicare, you can go to any doctor in the country. So the name recognition is kind of thrown out the window. There's a totally different set of data that you need to look at when you're making your decision there.
Yeah, it's an important thing to think about. And most people do it. They go to brands or they go to the comfort, right? So, there's insurance companies that have been around 100 years. I mean, there's companies that my grandmother had when she was young that she had all through her adult working career and had in retirement. And that's kind of what I was saying a little earlier when you have specialists. You have companies that specialize in group major medical insurance or individual major medical insurance. It doesn't mean that the Medicare insurance you get is going to be the same as experience you had, because there's a set of rules they follow under Medicare. So, yeah, you could have a Medicare supplement through Domino's Pizza and it'll work just as good as any major brand. And more importantly, what they do is they'll come out at a market rate cheaper than everybody else. And I learned this the hard way when I first started doing this. Obviously, I felt the same way, major brands. It's name recognition, right? Hey, how can you go wrong? And that was true until I learned what happened within this industry with these carriers. And what they would do is shut their books down and start new ones and come out at a cheap rate and let everybody else. They basically had a different price for people who were buying than they had for people who had it, right? So their clients, the ones they're supposed to be loyal to, paid a different amount. So if I had somebody that was 67 that had this insurance, they might be paying $200 a month. But I run into somebody who's 67 that wanted to buy that same company, same insurance, and it was $120 a month. It's just wrong. Doesn't make sense. And so you got to look out for that stuff. And it's hard because some of these brands do have the cheapest rates out there. But there's insurance companies that you've never heard of that actually are the best at doing this. So you have to look at Medicare differently than you look at all insurance you have your whole life.
That's right. So why, then, is Senior Health Medicare the best choice? There's a few reasons. Like we had mentioned before, we're independent and non-captive. We don't work for the insurance company. We work for you. So our goal is to put you in the best plan and keep you happy. It's that simple. There's a million choices out there as far as agencies and brokerages go. You can sign up with us today and cancel tomorrow and sign up with someone else. And we know that. We value your business, and we're always going to make sure that you're in the best plan at the best rate. That's one of the biggest reasons to go with someone who's non-captive. The other reason is Medicare is all we do. That's our main niche business. So we're always keeping up with the changes coming to Medicare, the new plans that are coming out, the plans that are being phased out, what companies are offering the best rates in certain areas, what companies are having their financial ratings changed, and we're constantly reviewing that on a regular basis.
In literal terms, Nick said we work for you. In literal terms, he meant it. We get paid because you exist as a client of ours. And this is one thing that a lot of advisors, we talk about the shady stuff that happens, and for some reason it's like this secret. Nobody wants to tell you how we get paid. It's a commission, and there's nothing wrong with that. It's not a dirty word. It means that we work for you, and you should hold us accountable for that. Every month you pay your premium, we get a check. It's a really tiny check, believe me. It's small. But we have a lot of clients, so it works well. And that's the only way that it works. And also the only way that it works is to make sure that you're happy. Our success is literally tied to your happiness with us. And that's why we put a lot of focus into service and advocacy. And you'll hear more about that in some of our other webinars. But it's one thing I've been saying lately is it used to be weird when you got bad service, and now it's weird when you get good service. I want to go back to that old way, and that's how we do it. So, every month that you pay your premium, we get a check. So, yes, we work for you, and therefore use us. And a lot of clients, we create such a good relationship with them sometimes. I get this from my clients, well, I didn't want to bother you. Well, that's what I'm here for. If you have a problem, call us. We can't help it if we don't know something's wrong. We have different phone numbers for these carriers for you. So call us, tell us your problem, and go golf. We'll deal with it. Go be retired. And that is probably one of the best things that can be conveyed is that we do absolutely work for you.
That's right. I'm glad you shared that, how we get paid, because that is something that is for some reason not talked about a lot.
It's great.
And we really do. We just depend so heavily on keeping you happy as a client, and also the other reason we want to keep you happy selfishly is so you refer your friends. And so really the way our business is designed, our best interests and your best interests are both in the same basket.
It is. It's symbiotic. So, and our goal is to actually get you not to call us unless you got to refer somebody, because people don't call us to say, hey, how you doing? They call us to say, I've got a problem. The idea is we help you pick something where those things don't happen. So that's the goal. We don't want to hear from you. Sorry. But that's how we do our thing. But we do reach out to you actively each year and all those things. So, and which leads into kind of how we're changing the way that this works. Insurance in general, but especially Medicare is the last holdout, and that door-to-door knock on the door, hey, you're turning 65, let me sell you something. Insurance agents used to even collect on the road. They'd walk down the street and collect premiums, like paper boys. And Medicare is a holdout to that. And so we're doing this a little differently, a little more advanced, a little faster. But the old ways of selling Medicare, where Medicare agents always have another area of focus, where they really just want to come in and sell an annuity. And that's pretty much the biggest one right there is they come in, hey, I'm your Medicare guy. I'll tell you everything about Medicare. And they give you this kind of basic, A does this, B does that, pays 80%, get a supplement, it pays 20%, boom, name, address, phone number, check. And then you think you're done, and they say, hey, what have you done to take care of your 401k? And they walk out with $50,000 check or $300,000 check in an annuity. So, these faux financial advisors, really just annuity salespeople, that's what they're after, because that's the money. That's that lost leader that they use Medicare for, because it's an easy knock on the door, because every single person that turns 65 has to talk to somebody regardless of their situation. So it's a real easy lost leader knock on the door for them. And we put a lot of focus into non-pressure, like no sales and no trickery. It's just education. The one thing I've said over and over and over for 14 years, you don't like me and you don't like what I have to say, thanks for coming. Have a nice day. Right? It's simple as that. You've all been buying stuff longer than I've been alive. You can see it coming from a mile away, and there's no reason to throw it at you. So we're just going to tell you how it works, and I like to hit people between the eyes and with the real stuff, and that's what we do. And we really, really focus on that education, and it's something that really stands apart, I think, with our clients.
That's right. So I think that pretty much sums it up. I mean, to recap it, Medicare, that's our sole focus. We consider ourselves and pride ourselves on being Medicare experts. We're independent, and we have deep relationships with all of the different insurance carriers. We understand their internal functions. We understand the different underwriting standards, and based on where you live and what your age is, who's the best bet for you as well.
And again, in a predatory industry, daring to be different, and we know that it works because we get a lot of referrals from our clients, and it really is. It's kind of a cliche thing to say, but the best compliment we can get is for you to refer your friends. But it's true. If you're referring somebody, family members, especially the ones you like, that means that you trust what we're doing. And I think that my business at this point, that's all that comes to me is referrals from my clients. And for that, we definitely put in a lot of work year to year. The educational approach, the no pressure consultative advising, the technological advantage, where one of the things that we hear all the time is, this guy came to my house, I did an application, and I haven't been able to talk to him in 3 weeks. We do what typical agents do in a day or two, and where it takes them 3 weeks. And then mostly just a pulse on what the future holds for Medicare, and making sure that you're in the right plan now, not waiting until things come up. We proactively err on the side of caution and say, hey, this is coming, this is going to be the result, this is what you should do. That's the recap of what we just talked about. Appreciate you guys joining us today. Nick, you got anything?
No, thank you.
Thanks, guys.
All right. Thank you very much, Kevin and Nick. Have a friend, family member, or neighbor who's entering on Medicare. Put us to the test today. We have our 1-800 number here up on the screen. Feel free to call. One of our advisors will be in touch. And then if you mention this webinar, we'll send you out a free prescription discount card. Again, if you want to visit our website, there's many more webinars there breaking down into different topics. That's www.seniorhealthmedicare.com. We thank you for listening today and hope you guys have a great day.